I should start by defining conversion therapy because it means different things to different people. So when I say conversion therapy, I'm talking about some kind of sustained practice. The practice could be prayer, it could be quote unquote talk therapy, it could be a workshop. Lots of different forms it can take, but all kinds of conversion therapy share one common goal, which is to avoid an expression of a 2S LGBTQ identity. In other words, there are practices that start with an assumption that some sexual orientation, specifically heterosexual people, and some gender identities, specifically cisgender identities, by which I mean where one's current gender identity is aligned with the gender that was assigned at birth, that those are preferred to 2S LGBTQ experiences. When I first went to give testimony for the Canadian Parliament in 2019, the Standing Committee of Health was doing a study, quite a comprehensive study on the health of 2S LGBTQ Canadians. And the premise of that study was they were looking at epidemiological data and they were seeing those really large gaps in health, fourfold higher rates of suicide and 40-fold higher rates of HIV, and they were trying to understand, well, how do these health disparities persist after 30 years of enacting really some of the best, most progressive 2S LGBTQ affirming legislation in the world? And it just so happened that when I went to give my testimony for that committee, the federal government had turned down a petition to enact a conversion therapy ban. And my community partners at the Community-Based Research Center and I were sitting on some data that we just happened to have already collected that gave us an estimate of the number of Canadians who had experienced conversion therapy. And so I brought those data to the Standing Committee on Health. The members of Parliament had some very good questions. They wanted to know, where were people going to conversion therapy, and were they paying money for it, and were they being sent across the border to the United States, and at what age were they starting? And so those questions formed a research program that has really been the lion's share of my work my first 3 years at SFU. We worked with survivors of conversion therapy, we worked with 2S LGBTQ community agencies, and we tried to run, we did run a series of interviews and surveys to provide answers. And then in December of 2020, I had the opportunity to go back to Parliament, well, virtually by Zoom, this time to the Justice Committee to share all of those results. And the results actually were able to help the legislators come up with a much stronger bill to ban conversion therapy in Canada. It made it clear that conversion therapy isn't just going away to a prayer camp and praying away the gay, which is kind of a common stereotype, that it also includes practices that are embedded within healthcare interactions, where healthcare providers, for instance, will deny someone self-determined gender identity. It will also include groups that get together, let's say once a week, and just try to talk about behavioral techniques to avoid 2S LGBTQ identities. So we were able to present data showing really that conversion therapy isn't one thing, that it's a kind of a grab bag of different practices. We also, of course, presented data on the harms of conversion therapy because we see that those who go through conversion therapy have to live with quite a lot of trauma and distress from it. And we showed data, quite importantly, demonstrating that about half of the people in Canada who start conversion therapy start it as an adult. And this was important because the first bill that was introduced back in the spring of 2020 really was focused on youth. And so by the time they came around with their new bill in this last session of Parliament, they were able to expand that and make sure that the amendment to the criminal code also applied to conversion therapy practices that were targeting adults.
Fantastic. So that's some quite important and consequential work that is making a difference in the lives of individuals then.
Thank you. Yeah, we're quite proud of it. And I should say, I mean, in addition to the students and research colleagues who supported that work, we couldn't have done it without conversion therapy survivors who had stood up and told their stories. Their sharing their experiences publicly, even though it was painful to do so, really opened the door for us to start to talk about this in terms of our research. So we're very grateful to them.